All right, I think we're live. Hi, Joseph. So nice to have you here this morning or this afternoon. I think it's afternoon now.
Yes,
How's it
yes.
going?
I'm doing great, doing fantastic. It's a lovely day. I live in Seattle. It's a little bit rainy, but definitely very happy that it's starting to get cold again.
Oh, nice. I love Seattle. It's so beautiful there. Lucky. Does it still rain a lot there?
Yes, yeah, unfortunately, it our last day of sunshine I think occurred 2 Sundays ago. So
Oh,
if it's sunny, the weather is beautiful, but we're back to the everyday, everyday depressing weather. But
oh,
honestly, I don't mind because I like drinking coffee while
oh,
looking
yeah.
at the rain, so it's very
Yes.
relaxing.
I love rainy seasons. I'm in
Yes,
Texas now and we don't get a lot of rain. The
yeah,
first year I was here was like we got so many storms and it was the first year of the Texas freeze. I don't know if you remember that.
yeah.
But yeah, since then we haven't had much rain, so I really miss it. So I'll have to come and visit you in
Yes,
Seattle.
please. My classmate just visited yesterday, and I brought him to Pike Place, my classmate for graduate school. So please let me know. I'll be your tour
Oh,
guide.
yeah, nice, nice. Well, let's get started. I'm going to just quickly introduce myself, just in case anyone is new to my page. My name is Claudia Garcia. I am the CEO and founder of Royalty Medical Solutions. We are a search staff and consulting business. We've been in business now for almost 20 years, and we are so excited to start a conversation with Joseph today, who is doing so many things. Dr. DNP now also has a beautiful resume from education to all of the things he's done in the executive suite right in healthcare. So I'm going to let him introduce himself and give us his background. I want to hear all about how you first got started in nursing and what prompted you to become a nurse.
Perfect. Yeah. Thank you so much, Claudia. So my name is Joseph, first generation immigrant from the Philippines. And the way I got into nursing was that nursing is my second career, right? And my first career when I arrived in the United States was I was actually a journalist, but it was not hard hitting journalism, unfortunately. I was writing about the Hollywood premieres of Transformers or the covering the Pacquiao fights in Vegas. So I knew I wanted to have a larger scale of impact to society. So I really started at the bottom. I started as a certified nursing assistant, then as an LVN, and then worked my way up to being an RN for VA Long Beach. And it was during this time wherein I started to really delve into leadership because I was a telemetry nurse, but I eventually became the clinical nurse leader for the psych unit of VA Long Beach. And one of the key problems that we were tackling during that time was the high level of restraints and seclusions. I think we averaged around 30 a year. So what we did was I was able to write a grant and was able to secure equipment for an intervention called multisensory stimulation. And the
Wow.
way it works is it's very nurse driven in nature, wherein you don't need a physician's order. So, and we're able to customize the intervention. So, for example, if the veteran was a former fisherman, when
Mhm.
they go into this room, when they were having an episode, they would see the sight of the sea, hear the sound of the sea, and even smell the scent of the sea, inspiring reminiscence in the process. And as a result, we were able to achieve a restraint-free environment for at least 2 years. And then
Oh,
it ended
wow.
up being published, and we ended up winning a national award.
Good for
And
you.
yes, yes, and it was definitely very mission driven and lucky as well. But after that, I was an executive director for the Medicare Quality Improvement Organization for California, wherein I had oversight over the quality metrics of around 314 hospitals, and was
Wow.
able to decrease readmissions at the state level, and we were able to save Medicare $980 million. And in my
Wow.
yes, yes, and in my next role, I was the associate chief nursing officer for a hospital for University of Washington Medicine. I'm not sure if you know the show. Do you know the show Grey's Anatomy by any
Yes,
chance?
yes, I
Yeah,
do.
yeah. So the inspiration behind that show was Harborview Medical Center because we're the
Oh,
only level 1 trauma center in 4 states, namely
uh-huh.
Washington, Alaska, Montana, and Idaho. And we also, during my tenure there, we were able to achieve magnet designation as a result of our mission-driven team. And it was
Wow.
actually during this time where I found my why, because when I was an ACNO for Harborview, I was getting a lot of these random calls from NP students from North Dakota, New Mexico, and
Mm,
Boston, wherein they were virtually begging for clinical placements, and they're saying they were
mm,
not going to be able to graduate without the right clinical placement. And for
mhm.
me, I said, this is crazy. You know, I'm in Seattle, right? So what I did was, for me, the best way to learn something is to write about it. So I wrote a research paper when I was, serendipitously, I was in my MPH program in Harvard University during that time. And I got into this rabbit hole wherein discovered that we have a national primary care shortage. We're going to have 120,000 shortfall of physicians by 2030. And also,
Mm,
it's the perfect storm. We have an aging population,
mhm,
and we also have a higher emphasis on preventative medicine because people are
mm,
living longer. And the Future of Nursing Workforce report stated that the key to solving that gap is
mhm,
optimizing the NP pipeline. And
mm,
that was how I was able to learn about this organization called NPHub, who was doing things the right way by having a robust vetting process, and each preceptor is interviewed one-on-one by one of our seasoned staff members to ensure that they are appropriate to precept students. And right now that I am currently the chief nursing officer of NP Hub, and we also launched the first NP specific job board called NP Hire. And I'm hopeful that we're able to serve not only healthcare organizations but the NP ecosystem in general. So that is my why.
Wow, Joseph, you're so young and you've had such a massive impact on healthcare already. From what you did for Medicare all the way to the things that you're doing today with nurse practitioners and trying to get them to graduate on time
Mhm.
and knowing that they're going to go and fill this massive gap in the future as we start to see the decline of not having enough provide primary care physicians. So you're doing big things. How do how do you get it all done? Because I see you running around all over the place. By the way, love your LinkedIn content. I
Yeah.
think it's awesome, and everyone's following along. You recently wrote a book, so let's. I know we weren't going to
Yes.
talk about that, but
Yes.
we're here.
Yeah.
Let's do it.
Yeah, and one of the I was a co-author for the leadership standards of practice from American Nurses Association. And that being said, it was such an honor to be a part of that writing process with once in a generation key leaders such as Dr. Tahan of MedStar, Dr. Katie of American Nurses Association, um, Dr. Lindell of University of Iowa, and it it what it did was it prepared leaders to it prepares nurse leaders to tackle the new problems of the next generation, because what we've learned from the pandemic, and it was such an honor because I was the youngest author in that writing group of that national task force. And what we learned, and I actually lived. Sorry, I'm kind of like getting emotional because it brought me back to the pandemic. Because what we learned during that time was that what how we prepare leaders before is not what is going to bring us to the next level, because what we learned during the pandemic is that there are a lot of leadership competencies that we need in order to
Mm,
succeed, especially with being faced with such an egregious situation such as that pandemic. No
yeah.
one told me that you needed to learn about supply chain management, right? How do you
Mm,
manage a P&L? How do you manage your costs, because hospitals have razor thin profit margins right now?
mhm.
And also, how do you optimize diversity, equity, and inclusion amidst the changing healthcare landscape? So those are some of the things that we really discussed and some of the conversations were actually very heated because we were all advocating for the same thing, which was ensuring that we prepare leaders. So compared to other editions, the third edition really emphasizes the need for not only financial management, but
Mhm.
also leveraging technology such as
Yeah.
artificial intelligence and integrating that into your leadership practice.
Wow. So good. I
Yes.
am sure so many lessons came from the pandemic, so many things that we probably couldn't have even imagined that were going to take place, and challenges that y'all faced in during that season, and y'all handled it with grace. And I love that you are taking everything that you learned and then saying, how can we take this and then do things better for the next thing that possibly could come up, right? So
Yes.
yeah, that's brilliant. I want to know, what's the name of the book, first of all, before we move on.
Um, American Nurses Association Leadership Scope and Standards of
Okay.
Practice.
Okay, and they
Yes.
can find that on the association website?
Yes, American Nurses Association. Yes,
Perfect.
it's the third edition. So it was very when I saw it for sale in the last Magnet conference, I was like, oh wow, it's actually here being published. And the beauty of networking as well was that I when I posted it on my LinkedIn profile, people were actually saying, oh, can this be translated in other languages as
Oh,
well, such as Spanish? So now I'm
there you
trying to
go.
reach out to my co-authors if that is a possibility because I think a lot of those concepts are very global in nature, and I think if we can maximize our scale of impact further, that is that is such a gift. And also, one of the key concepts there as well, aside from financial management, is data analysis, because in
Okay.
the end, a strategy without data is just poetry.
Yeah. That's good. That's good. That's a good quote. Should put it on
Yes.
your LinkedIn.
Yes.
That's a good
Yes.
one.
Yes. Yes.
We'll drop the link to the association in the comments so that if anyone is interested in purchasing the book, they can go ahead and do that.
Yes.
Well,
Mhm.
let's go back a little bit to talk about the new product, which is the NP Hire. I'd love to hear about, how it works, and also what sets you apart from other agencies.
Yes. What sets us apart from other agencies is we have a robust user and employer experience. And we've built partnerships with key organizations such as University of Washington, Stanford, Lee Health, Penn Medicine, to name a few. And how we decrease the level of effort for employers to find the right candidate is we were able to leverage AI, and as a result of our domain expertise in the NP space, we were able to create filtering options, ensuring that they're able to source candidates in the most efficient way possible, whether it's through their certification, whether finding a specific nurse practitioner based on their EMR experience, whether it's Epic or Cerner, and also trying to integrate the timeline, right? So we also wanted to integrate into the user experience on how soon that candidate is open to work. So by integrating these elements, they're able to decrease the level of effort. And also, one of the service lines that reported to me when I was an ACNO for University of Washington was, um, to name one, was wound, the wound care the wound care clinic.
Mhm.
And had I and this is the product that I wish I had. I think that is what makes this so exciting for me, is because I feel like I'm solving my own problem when I
Sure.
was a healthcare executive. So for example, I one of the positions that was very difficult to fill was a wound care nurse practitioner. And
Mm,
aside from those clinical parameters and competencies, you're actually able to integrate a required or an optional question. So,
mm,
for example, if I had this platform, I would have asked, because one of the key metrics that I cared about as an ACNO was patient satisfaction scores, and
mm,
one of the evidence-based interventions in improving patient satisfaction was integrating teachback. So I could have
mm,
probably asked, as candidates were applying, what is your experience in integrating teach back and patient education? Or I can even ask, do you have wound care certification, to instead of you asking that question once they've advanced in the interview process already. So
Sure.
it just creates efficiency in our, and prevents duplicative work in the hiring process.
Okay, so there is like full transparency when they apply. They're able to put all of their skill sets into the platform so the hiring manager can identify them quickly. And you're not waiting until they're in the second, third phase of the hiring process that you find out they don't have a specific skill set or a specific certification. So that's good. That's good. And
Yes.
is this now open? Because I know you were doing some partnerships with other agencies, such as mine, if as long as we have some NP roles open. So how does that work? How do other agencies get a hold of you and partner up with you?
Well, honestly, they can contact me on LinkedIn. You can call me at 310-465-5602 as well. I'm at your service, and we're always open to partner. And the beauty of the platform as well is that we're leveraging employer feedback as we speak, so it's constant iteration. So for example, one partnership said, oh, maybe we can integrate RVUs in 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 ensuring, because with regard to the key experiences of NPs, one of, as you know, in a value-based purchasing world,
Sure.
productivity is one of the key things that employers
Mhm.
care about. So we even integrate that RVU question once they are applying and in the job posting as well. So
Mm.
this is very exciting because employers are not only able to use the platform, but they're able to be a part of the optimization process to
Mm.
improve the manner by which they hire NPs.
That's awesome. Now, is there any cost to the employer who is searching for candidates?
Yes. Right now, we're actually giving 6 months of free employer access. So right now, it's cost free, and definitely it's in our long term plan. However, the mission critical goal right now is producing the best platform possible for the NP ecosystem. So
Okay.
please take advantage of this great opportunity.
That's awesome. And then the NPs who are putting in their application and their information, what does that look like? Is that a membership? Is that
It is
Mhm.
kind of just like LinkedIn, right? They
Okay.
can just log in, and it's totally free for NPs to join. That being said, there might be a VIP access down the line, but right now it is totally free. Our goal is to serve the NP ecosystem. Also, shout out to all the NPs. Happy NP week, everyone.
Yeah, yes. That's awesome. So this is a great product for them. I'm sure that they are super excited. And those that are getting ready to graduate are excited about it. So you're walking alongside them through their entire journey, it sounds like.
Yes, yes. We want to support them every step of the way, from NP school to finding a job. And one of the most fulfilling parts of it as well is that, as you know, there's a lot of nurse practitioners that have built their own clinics as well.
Mhm.
So they were now they're actually joining NP Hire as employers. So it's almost like we're being reunited with our old friends, such as
Oh,
Dr.
yeah.
Judith, to name a few. And it's just yeah, I I have no words. I feel that of course it's definitely a great honor to be serving the large employers, but for me it really fills my cup that, oh, I was a preceptor, I was a student with NPHub, and thank you so much for building this platform for us. And they said that utilizing the other platforms, they said that it's like they use terms such as like it's like a flea market wherein they don't there's no focus in hiring nurse practitioners, because the nurse practitioner role is very specialized in nature. And if you don't integrate those evidence-based clinical components, it definitely increases the level of difficulty and complexity in the hiring process. And they said the fact that we designed the platform in a very intentional manner, I think she already had 4 candidates after a week or two of posting those jobs. So hearing that for me was one of the really makes me smile because it shows that we're able to really help not only the large employers but the preceptors and the students that went through our through NPHub.
That's awesome. I love that they're able to not just you supported them, and now they're able to support you by utilizing the product that's going to help them fill their private
Yeah.
practice with other NPs, right? So they're it's almost like a way of giving back, right? So
Yes.
they're
Yes.
giving back, and hopefully they're hiring some of those new NPs that are coming out of the program. So
Yes.
it just
And that being said, you actually said something very interesting as well, hiring the new graduates. So one of the key things that we integrated into our platform as well is integrating the level of experience, advanced practice experience that NPs have. So in the event that that job is open to new grads, that is actually highlighted in the job posting, and it just goes to show that aside from advancing your professional development by being a nurse practitioner, being a nurse practitioner is an economic mobility engine as well. Because as you can see, they came from being a nurse to being an advanced practice provider, then to becoming an entrepreneur. So we
Mhm.
really, and based on what I've seen as well, is that a lot of the nurse practitioners who built their own clinics are first generation immigrants and people of color, such as myself. So
Mhm.
as a first generation immigrant, that truly inspires me and gives me the inspiration to wake up every day and do what I do. And I think it's the same way for you as well, because I've seen that you're a champion of diversity, equity, and inclusion. And thank you for everything you do um, for the diverse populations of nurses as well, Claudia. I really
Yeah.
appreciate that.
Of course. I love doing lives like this and highlighting brilliant professionals and like yourself. And anytime that there's something that I feel should be, given back or, showcased to the network, then we get on a live and we talk
Yeah.
about it and we share it. I am so thankful that you took the time out of your busy schedule to hang out with me today on a Wednesday afternoon. I know that you're going to continue to do big things, and I am watching, supporting, and hope to be part of it. And anyone that wants to get a hold of Joseph, he is so accessible through his DMs. And also, we are going to put all the links here in the comments below. Joseph, did you want to share anything else? Any final words? Maybe advice for the new grad? What would be if you were going to give them one thing? What would that be?
I think one thing is being very intentional with your
Mm,
professional development, right? It's not just knowing where you need to go, but also
mhm.
building your community. And you need to find those communities. So, for example, for me, I found the Philippine Nurses Association of America as a key community. One of my first academic presentations was in a Philippine Nurses Association um, event in Southern California. So, find your community,
Yeah.
find your mentors, and just ask, right? I mean,
Mhm.
in this world, a lot of nurse executives, because they went through what you're going through right now, just
Yep.
send them a message on LinkedIn, and if they say no, then that's fine, right? But if you don't ask, the answer will always be no. And also
Mhm.
find those people that you want to be 5 years from now,
Mm.
right? I think
Yeah.
that is the key. So by connecting with those people and just ask, hey, can I have an exploratory 15 to 30-minute conversation with you to learn about your journey? And from there, instead of making those mistakes, you're able to learn from someone who actually operationalized that journey, making it actionable in the process.
Yeah, that's really great advice. And just, use LinkedIn as your network, just the way that Joseph and I have met and many others have met and connected. It's a great place to collaborate with folks and to find your mentors and your coaches. And there's just so many people here willing to help you just like Joseph mentioned. So I hope that everyone has a wonderful Wednesday. And this has been such a great conversation. I look forward to talking with you again. Let's do this again. And I'm sure you're going to be up to something exciting and just, I'm going to see
Yes.
something new and I'll be like, Joseph, let's get on, let's talk about it.
Yes. And as I said, if there's anyone who wants to get a hold of me, Joseph at nphub.com. Um, I'm always here to help. If whether it's you're trying to figure out your professional journey or writing a research paper, please just reach out. Just holler.
Yeah. Thank you so much, Joseph. I appreciate you. Have a wonderful day.
Thank you so
Thank
much.
you
Have a great
guys.
rest of the
Thanks
day.
for watching, everyone. Bye bye.
Thank you. Bye.